Welcome again. We want to discuss ectopic pregnancy, the early symptoms, early warning signs that you can see so that you'll be able to pick it up. And when we're talking about ectopic pregnancy is just when the womb has something like hand like that, which we call fallopian tubes. And the egg, after fertilization, is supposed to implant within the walls of uterus. But instead of that, it decides to implant inside the fallopian tube. And fallopian tube is not stretched the way the uterus will be able to stretch to accommodate the weight and the weight of the baby. And what happens? It can become ruptured, or it just keep going there until the signs and symptoms are showing, and we'll be telling you what you can do about it. And when we're talking about the fallopian tubes, it's connected to the womb. Assuming this is the womb, this is the fallopian tube, this is the ovary. It looks like hand if you can cast your mind back. So if the egg gets stuck in them, it won't develop into a baby. And your health may be at risk if that kind of pregnancy continues. And unfortunately, it is not possible to save the pregnancy because it is usually the tube has to be removed, either using medicine or operation or something. And what are the symptoms? So that you can, if you are able to pick it early, it is very good. And symptoms of ectopic pregnancy are so numerous, and we'll be talking about some of them. And ectopic pregnancy does not always cause symptoms most of the time. And at times, it might be detected during a routine pregnancy scan. When you just say, I have not seen my period, at times you will not even feel the symptoms of pregnancy. And if you do have symptoms, at times it will start developing from the 4th week of pregnancy and between the 4th and the 12th weeks of pregnancy. And the symptoms can include a combination of a missed period. You have not seen your period and you think you are pregnant. And other signs of pregnancy. Tummy pain, especially at the lower down, especially in one side, there might be vaginal bleeding or a brown watery discharge coming from your private part. Pain in the tip of your shoulder, the tip of your discomfort when you are peeing or you are pooing. Some of us they have some have fainting attack because it's usually at times associated with low blood, and that's anemia. But these symptoms are not necessarily a sign of serious problem. They can sometimes cause by other problems. That's what we call differential diagnosis. So it is when you get to your doctor, you'll be able to say, okay, the doctor will be able to diagnose and say this is what is happening after carrying a objective and subjective history and all that. And what can cause an ectopic pregnancy? In many cases, it is not clear. At times, it is idiopathic. We don't know why women have ectopic pregnancy. But at times, it's happened when there's a problem with the fallopian tubes. And we know the fallopian tubes is the one that will take the egg. And instead of implanting somewhere, come and implant. If there is a problem with the fallopian tubes, such as maybe they have been narrowed or they are blocked fallopian tubes, ectopic pregnancy can happen. Because the egg will not be able to pass because it's blocked, and we just stay there and start fertilizing and start growing. And of course, the following are all associated with an increased risk of ectopic pregnancy. Number one is pelvic inflammatory disease, a disease of the entire pelvic organs. That's our uterus, our ovary, our fallopian tube, the female reproductive system. And it's usually caused by a sexually transmitted infection. It is one of the reasons. Of course, if somebody has previous ectopic, or maybe the right tube had ectopic, it is possible for someone to still, the risk for another ectopic pregnancy is around 10%. If there is a previous surgery on the fallopian tube, maybe they did a unsuccessful female sterilization procedure, you understand? You don't want to have babies again. It can happen. Fertility treatment such as IVF, taking medicine to stimulate ovulation, the release of an egg, can increase the risk of ectopic pregnancy. You understand? Becoming pregnant while using intrauterine device, what they put at the mouth of the cervix, or IU, intrauterine system, or for contraception. It is rare to get pregnant while using this thing. But if you do have it, most of the time you might likely come down with ectopic gestation. What about smoking? Smoking is one of the risks of ectopic gestation. Increasing age, maybe you are advancing in age, the risk is highest for pregnant women age over 35. You can't always prevent an ectopic pregnancy, but you can reduce your risk if you work on it. At times, you can use using a condom when you are not trying for a baby to protect yourself against STI. And you can reduce your risk by stopping smoking if you smoke. Ectopic pregnancies can become life-threatening, especially if your tube breaks. That's ruptured ectopic pregnancy. This is a ruptured ectopic pregnancy, and it can cause severe bleeding, infection, and sometimes if it is not gotten on time, it can lead to death, because it is a medical emergency. When we say something that you don't need to wait. So what are the complications? An ectopic pregnancy is a medical emergency. Your uterus is the only organ that can hold a growing fetus. It can stretch, expand, and as the fetus grows, your fallopian tubes are not flexible. That's why they burst, and the egg, as the fertilized egg develops, they think they are growing, and they just burst. So if this happens, it can cause severe life-threatening internal bleeding, and it's dangerous. So an ectopic pregnancy needs to be treated right away to avoid injury to your fallopian tube and other organ, to prevent internal bleeding. An healthcare provider must treat ectopic pregnancies, immediately. Your doctor will ask you about your symptoms, and you usually need a pregnancy test to determine if you could have an ectopic pregnancy. If you to determine why you had ectopic pregnancy, you may be referred to specialist early pregnancy clinic for further assessment. You'll be asked to do scan. Blood tests may be carried out to confirm the diagnosis. So whenever you have missed your period, it's not enough to just do your test. You have to go visit a doctor. Health is wealth, and preventive health is the reason I am here. See you in the next video.